Are you struggling with ABG? So don't worry, in this video, I will teach you a step-by-step method to master ABG analysis for your NCLEX exam. Welcome back to ManpreetRN Talks, your one-stop channel for NCLEX success. Today, we are dividing into one of the most high-yield and tricky topics, that is arterial bed scans, ABG interpretation. So I will break it down step by step so you will never get confused in the exam again. So by the end of this video, you will be solving ABG in a seconds like a pro. So let's get started. So step first, you should know the normal ABG values. So parameters or non-normal values are normal pH value is 7.35 to 7.45. PaCO₂ is 35 to 45 mm of Hg. HCO₃ 22 to 26 milliequivalent per liter. PSO2 is 80 to 100 of Hg, and O2 saturation is 95 to 100%. So remember, if the pH is less than 7.35, that means it's acidosis. If pH is more than 7.45, it is alkalosis. So next, step 2, identify if the problem is a respiratory or a metabolic. So if PaCO₂ is that means respiratory component. If biocarbs are there, that means metabolic components, means kidneys are involved. So if there is respiratory system, then it will involve lungs, and if there is metabolic component, it will include kidneys. Step 3. So step 3 is match the pH. So if the pH is acidotic, means less than 7.35. So in this, so there is high PaCO₂. So it will include respiratory acidosis. So if there is low bicarb, it means metabolic acidosis. So if the pH is alkalotic, means more than 7.45. So you should remember two components like in then pH low PaCO₂ means respiratory alkalosis. High bicarb means metabolic alkalosis. So you should remember this. It is very important. So next step is check for compensation. So in this uncompensated, that means pH is abnormal. Only one component is abnormal. Either only pH will be abnormal. So bicarb and the PaCO₂ will be normal. So partially compensated, it means pH abnormal and both bicarb and PaCO₂ will also abnormal. So all the components they are in abnormal. So there is partially compensated. Next is fully compensated. It means pH is normal, but PaCO₂ or bicarb both on and off. Maybe one will be high and one will be low. So remember, the body always try to balance pH using the opposite system. So lungs compensate for metabolic fast, and kidneys compensate for respiratory very slow. So next step 5 is look for oxygenation. So PaO2, if it is less than 80 of Fg or O2 saturation is less than 95%, it means patient is getting hypoxemia. So this will identify respiratory failure situation. So next, NCLEX style practice question. So let's, for example, first, if the pH is 7.3, PaCO₂ is 50 mmHg and bicarb is 24. So let's solve it. So pH is less than 7.35. So it means acidosis. And PaCO₂, that is high, normally is 35 to 45, it is 50. So it is respiratory cause. And bicarb, that is 24. So normal is 22 to 26. That is normal. So there is no compensation. So correct answer is respiratory acidosis, and there is no compensation. So it is uncompensated respiratory acidosis. So NCLEX tip here to remember for the exam is that is usually uncompensated respiratory acidosis is usually seen in the COPD patient, asthma, pneumonia, and opioid overdose. So you can remember for the NCLEX. So next example is pH 7.50, PaCO₂ is 30 of Hg, bicarb is 24 milligram per liter. So let's solve this. So pH is more than 7.45, that means alkalosis. PaCO₂ is low, that is 30, it means respiratory cause. And bicarb, that is normal, so there is no compensation. So correct answer is respiratory alkalosis, and that is uncompensated respiratory alkalosis. So NCLEX tip here to remember that is usually seen in the hyperventilation patients, usually in panic attack, pain, or in fever. So example third, pH is 7.20, PaCO₂ 40, bicarb is 18 milliequivalent per liter. So let's solve this. So pH is less than 7.35, that means acidosis. Bicarb that is low. So remember, so it is metabolic cause. So PaCO₂ that is normal. Normal is 35 to 45, that is 40. So PaCO₂ is normal, so there is no compensation. So correct answer is metabolic acidosis, but that is uncompensated metabolic acidosis. So NCLEX tip here is so think decay in the diabetic ketoacidosis, renal failure, and diarrhea. So their metabolic acidosis is happen in diabetic ketoacidosis, renal failure, and diarrhea. Example 4. pH is 7.37, PaCO₂ 55, bicarb is 30. So let's solve this. pH that is 7.35 to 7.45, that is normal. So that is normal, but a little bit in the acidic side of like 7.35 to 7.5, that is 7.37. So next PaCO₂, it is 55, that is high, so it is respiratory acidosis, and bicarb that is 30, it is also high. So in these kidneys, they are compensating. So answer are fully compensated respiratory acidosis means kidneys they are compensating for it. So NCLEX tip here is that is usually seen in the chronic COPD patient, long-term hypoventilation. So NCLEX tips and shortcuts are you should remember. Word ROM means respiratory, they occur in opposite and metabolic equal. So if pH and PaCO₂ moves in opposite direction, so it is respiratory. And if pH and bicarb moves in a same direction, that is metabolic. So you can remember ROM word. So respiratory opposite, metabolic equal. Next is acidosis cause. So acidosis cause they are CNS depression, confusion, weak pulses. And alkalosis causes are nervousness, tingling, tetany, arrhythmias. So if a question mentions DKA, so it is also include DKA. So ketoacidosis, it means metabolic acidosis. So if the question mentioned panic attacks, hyperventilation, so think respiratory alkalosis. So if the question mention vomiting, so think metabolic alkalosis. Means vomiting, vomit acid is out, so base is left in the stomach, so it alkalosis. So if the question mention opioid overdose, COPD, so think respiratory acidosis. So next question, a client with COPD is receiving oxygen at 2 liter per minute. So ABG results show pH 7.32, PaCO₂ 55, and bicarb is 24. So what is the correct interpretation? So it is so let's solve this. So pH that is 7.32, that is low, so it means acidosis. PaCO₂ is 55, that is high, so it means respiratory. And bicarb that is normal, so uncompensated respiratory acidosis. So that is I have already discussed previous, that is common seen in COPD patient. So next question, a client who has been hyperventilating due to anxiety, and ABG shows pH 7.48, PaCO₂ 30, bicarb is 24. So what is the nurse interpretation? So let's solve. So pH that is high, so 7.48 means alkalosis. PaCO₂ that is low, so it means respiratory cause. And bicarb that is 24, it is normal, so there is no compensation, so uncompensated. So correct answer is respiratory alkalosis, uncompensated respiratory alkalosis. Next question, a diabetic ketoacidosis. So patient's ABG results are PS 7.28, PaCO₂ 38, and bicarb was 18. So as I have discussed previous, so DKA just think metabolic acidosis. So otherwise we will solve this. So pH that is low, that means acidosis, and bicarb is also low, means it's metabolic reason. And bicarbs, it is low, so it is metabolic. And PaCO₂, that is 38, so normal 35 to 45, so it is normal, so uncompensated. So this metabolic acidosis. So classical and for detail. So next question, ABG results are pH is 7.36, PaCO₂ 55, bicarb is 30. So which condition is present? So options are fully compensated respiratory acidosis, uncompensated metabolic acidosis, partially compensated metabolic alkalosis, uncompensated respiratory acidosis. So pH is normal, 7.36, but it is more leading to acidic side. So and next is PaCO₂, that is 55, that is high, so it will involve respiratory pause, and bicarb is also high. That means kidneys they are compensating. So correct answer is pH, that is normal. So that is fully compensated respiratory acidosis. Next question, a client with long vomiting has the following ABG. So ABG are pH 7.52, PaCO₂ 42, and bicarb is 30. So what is the correct interpretation? So pH 7.52, that is high, so it is alkalosis. Bicarb, that is also high, so it is metabolic cause. But bicarb, that is normal, so that is uncompensated. So correct answer is metabolic alkalosis. So again, I will repeat the NCLEX exam clues so you can remember for exam. So COPD, overdose, and hypoventilation, that means respiratory acidosis. Panic attack and hyperventilation, that means respiratory alkalosis. DKA, diarrhea, renal failure, so metabolic acidosis. Vomiting, NG suction, antacid, so that include metabolic alkalosis. So we have practiced a lot questions. So NCLEX loves to test you on ABG. So usually 5 to 6 questions come directly from this topic. So do more and more practice. So next I'm giving another example. So solve this and write down the correct answer in the comment sections. Don't forget to like, share, and subscribe to ManpreetRN Talks for more NCLEX hacks and exam strategy. And comment below which ABG imbalance confuse you the most. So I will cover in the next video in more detail. Thank you for watching it.